Hello everyone, my name is Dr. Dave. I'm a licensed podiatrist. I'd like to thank you for watching my video on my Frugal Foot YouTube channel. I have an interesting video for you today because in this video I am going to discuss the difference between minor surgery and major surgery. Now before we get started, please hit that thumbs up button and don't forget to subscribe to the channel. So do you know the difference between minor surgery and major surgery? It is really important to know the difference. Maybe you're planning a surgery. Maybe there'll be one coming up in the future that you don't know about, but it's nice to know the difference beforehand. Now, I do videos primarily about feet, but this definition really holds true regardless of what type of surgery you have. So what is the difference? Could it be the length of time in the operating room? No, that's not the difference. How about whether this is done in a surgery center or if the surgery is done in the hospital? No, that's not the difference between minor surgery and major surgery. How about if you need an anesthesiologist? Nope. I can tell you what the difference is. I can give you the exact definition of major surgery versus minor surgery, and here it is, and listen very carefully. Major surgery is any surgery that is done on me. That's right. Anything can be done on you, and that's minor surgery, but it could be just be a cavity filling on me, and that's major surgery. Now, you may say, doctor, that's just a comedy. That's just a funny response, a funny definition. And yeah, it probably is, but there is a lot of value to understanding that. I cannot tell you how many patients come in to see me that are looking for foot surgery, and it doesn't have to be done. That is called elective surgery. And when you look at that, you have to educate the patient. Hey, here are the good things that can happen, but here are the bad things that can happen. And oftentimes that isn't discussed with the patients. Have you had experience like this? Let me know what you think in the comments. It's really important to weigh out the pluses and the minuses before having surgery. Now, there are times when you have to have surgery. If your doctor tells you, look, you've got a heart condition, and if you don't do this surgery, you're not going to make it. Well, obviously, that's an easy decision. But in terms of things like feet, maybe you're going to the doctor because you have a hammer toe that you don't like the way it looks, or a bunion, and it doesn't, fit well in your shoe. I've had a lot of patients that come in to see me after having surgery somewhere else, and I'm certain that there's other patients that I've done surgery on that have gone to see other doctors, and they're not happy with the way things ended up, and they wish they hadn't done their surgery. When you think about that, especially as a clinician, it changes how you practice in the future, and you're a lot more conservative. And if you're a patient and you've been down that route and you've had a bad experience, you're probably going to be a lot more hesitant having future surgery, especially those that are elective. And so I bring this point up so that you can really understand that all surgeries are major surgery. It's just that each surgery has a different level of majorness to it, right? If you understand what I'm saying. And that's really important. So consider those things before you have surgery. Is it something that you need to have done, or is it something that you want to have done but you don't need to have it done? And if so, is it really worth doing it? Because you want to be able to have a quality of life after your surgery that you can enjoy and be able to do the normal functions such as walking or picking up a pen or seeing, hearing. So those are very, very important things to consider before surgery. So if you find any value to this, please give the video a thumbs up. And again, please don't forget to subscribe. I'm Dr. Dave, and I'll see you on my next video.